Meanwhile, let's talk about COVID. The Moderna COVID vaccine is being rolled out to Australian pharmacies this week after the first batch of doses arrived in the country on Friday.
Peter Guthrie is a pharmacist in the Melbourne suburb of Ascot Vale and a member of the Pharmaceutical Society of Australia. He joins us now. Good morning. Are you expecting a busy day?
We are expecting a busy day here at the pharmacy. It is our first day on the Moderna rollout, and after we opened bookings yesterday afternoon, we've seen a lot of bookings in overnight. So I'm on the late shift today, but my colleagues will be very, very busy vaccinating through the day this morning and through the evening.
Yeah, so Pete, when did you get the Moderna and what was the process of sort of being one of the pharmacies to access it? Was that tough?
So we've had the AstraZeneca vaccine for some time here at Ascot Vale Pharmacy, like a number of pharmacies around Australia. Moderna being the mRNA vaccine, when that became available to pharmacies, we were allocated as one of the first ones, being sort of in that Melbourne strip where we are seeing more cases of COVID. So we saw some prioritisation in those areas. So a large number of pharmacies across metropolitan Melbourne and indeed Sydney and other areas were prioritised, and we were really lucky to be part of that group.
Yeah. Hey, Pete, just for people who don't know Melbourne, can you just sort of describe what your clientele, you know, what the suburb is like, what the clientele are like, and how they've been feeling about access to vaccines?
Yeah, it's a really interesting question. We're quite close to Melbourne Showgrounds and Flemington Racecourse for those that don't know the area. And it's a real mix in our suburb. We have a large area of people who've lived here for decades. We have some of those high-rise towers that were locked down last year in Melbourne's initial stage 4 lockdown. So a really diverse clientele. We're also a 24-hour pharmacy, so we have quite a large feeder area, particularly later in the evening. So me working largely after hours, I've had lots of really fantastic conversations with some people who are waiting to get round to it, some people who want to learn more about the vaccines, some who are much more enthusiastic about the mRNA vaccines than they are, for example, with AstraZeneca, and others who are really, really keen early on, and some of our patients have been vaccinated for several months now.
Yeah, and Moderna, of course, is the second mRNA vaccine for Australia after Pfizer. Why do you think it's proving so popular if you're saying that you're almost already booked out?
Well, it's remarkably similar to the Pfizer vaccine, and I think for a long time there's a large number of Australians that the Pfizer vaccine or mRNA vaccines were their preferred choice, and we're really excited to be able to offer it. And we've also had a large number of younger people, and we live in an area with quite a few younger people who've only really had availability of vaccines opened up to them recently. So for Moderna, people have seen those as an equal choice to Pfizer, and compared to the accessibility through some of the government clinics where there can be a wait time, we have plentiful appointments. So I think that's why we've seen a lot of enthusiasm. But we've also particularly seen parents of high school children really keen to get their kids vaccinated early on before the return to school plans come into effect.
Yeah, Gladys Berejiklian yesterday was saying it's just such a critical age group to try and get them vaccinated. So you're seeing that here as well?
Absolutely. When the first announcements from the Health Minister about Moderna arriving in Australia were there, I think I worked one of those evening shifts, and I took dozens of phone calls that evening from parents really keen to get their kids booked in.
Yeah. Hey, Pete Guthrie, I hope you have a great day. It's good to be busy, and good to be busy for a good reason.
Excellent. Thank you.
Yeah, it's great to see the